Okay, you are now live.
Brilliant. Miriam, okay, well, first of all, obviously, we're here tonight, as usual, Public Child Protection Wales. We are trying to spread awareness of the new comprehensive sexuality education that we have coming into the UK. And tonight we are honoured to be joined by Dr. Miriam Grossman. Dr. Miriam Grossman is she specialises in child, adolescent, and adult psychiatry, and was working in the UCLA for many years, over a decade. And Miriam started noticing some things which didn't seem so good with the sexual health of the pupils that she was seeing and the sex education they were receiving. We were fortunate enough to stumble across Miriam in our investigation into the sex education. And yeah, Miriam's been a great support and source of information so far. So we are delighted to bring her on tonight to talk more about her experience with sex education and its implications over in America. Hiya, Miriam. Thank you so much for coming on.
Hi, Adele. Thank you for having me. You know, I love your organization. Doing great.
Well, like I said, it's just amazing to have come across you. First, what we found was I came across a video of you on YouTube speaking at a school that had been organized protests trying to stop the sex education. I can't remember what state that was in. And then we came across your book, You're Teaching Our Child What, which is not your only book. Your first book, Unprotected, as well. And obviously, we've recently received a copy of your book, The Black and White Puppies. And yeah, maybe you could tell us a little bit about these books, Miriam.
Sure. Well, my first book that was meant for the general population is called Unprotected. And the way that I came to write that book is, as you said, I was working at UCLA, the University of California at Los Angeles, which is a huge 38,000 students, one of the best universities in the country. Are you hearing me okay? Because there's a bit of an echo.
Nope, I can hear you good.
Okay,
it is a little bit quiet my end, but it must just be me.
Okay.
No, yeah, carry on, Miriam.
Okay, I'll carry on. I was working there with students as a psychiatrist in the counseling center, and I was there for a very long time, for 12 years actually, and I noticed in the course of those years that many students were coming to me in distress, and their distress was related to some decision that they had made in terms of a sexual relationship. Like, for example, maybe they had just found out that they had a sexually transmitted infection, or that they were pregnant, or they had just had an abortion, or they were worried about having HIV, or even just a romantic breakup that caused a lot of emotional turmoil. Now, I used to see, of course, both men and women, 17, 18 years old and up. But most of the people that were coming in with these sorts of issues were young women. And, you know, I would support them and talk to them and try and help them out. But really, there wasn't that much I could do because, they already went through the event, and there wasn't much I felt I could do except sometimes, hand them a box of tissues while they were crying in my office. And I was very frustrated with that. It wasn't enough. I didn't go through medical school and training to just sit with someone and hand them tissues. And the sad thing was that their suffering and their distress was really 100% avoidable. Okay.
And when did you start linking that? When did you start realizing that actually this is a result of, what we are educating them?
Well, I got into a lot of conversations with these students and discovered that even though they were among the best and brightest students, very accomplished, they were missing tons of information in terms of understanding sexuality, sexually transmitted infections, the efficacy of condoms, safe sex, all sorts of things. The increased vulnerability of women compared to young men. They didn't know about a lot of the things that I'm going to be explaining to you today. And they would ask me, why didn't I know that? Why didn't anybody tell me that condoms are not close to 100%? They thought they were almost either 100% or 90% in preventing the pregnancy, STIs, which is not accurate. They felt that casual sex, hookups, just having a casual encounter once or twice with somebody is not something that really should affect them, that there would be something wrong with them. If they had some emotional reaction to a sexual encounter, they would think like, what's wrong with me? Everyone else is having casual sex. What's wrong with me that I'm still thinking about this guy and I'm wondering if he's thinking about me? What's wrong with me? And I would explain to them that there's really nothing wrong with you. It has to do with how we're made and how our bodies respond to sexual intimacy. And they would just be blown away by some of this information. Why didn't I know? And it was actually some of these students that said to me, you have to write a book.
Yeah.
And so, that was part of it. Then I started to explore on my own some of the websites and some of the material that young people go to and are exposed to when they're learning about sexuality. And that's when I was very shocked and disturbed to see what was there. And I came to the conclusion, which I still strongly believe, that what we call comprehensive sexuality education and you call RSE,
relationships and sexuality education,
is really about sexual freedom. It's not about sexual health.
Yeah.
It's about exploring your sexuality, expressing your sexuality, your sexual rights.
Yeah.
And not about staying out of the doctor's office, staying emotionally and physically healthy, because you can't have it both ways. If your priority is sexual freedom, then sexual health is going to suffer.
Absolutely.
Can't have it.
It seems to be very much that we as adults just need to accept that this is what children do, so we have to tell them how to do it with minimal risk to STIs and pregnancy, and that's that's what it seems to be to
Adele, I'm going to just tweak what you just said just a bit, because it's true that parents are being given the impression that, look, your kid is just going to have sex and we just have to minimize the risk. But that's not what they're telling the kids. They're telling the kids that they are sexual beings from cradle to grave, and that they have the right to become sexual and to express their sexuality, and that no one can tell them, not their parents and not their doctor and not their teacher, that they're not ready, that only they decide when they're ready. So they're not giving kids a red light at all. They're giving kids a green light, a big, fat, shining green light that celebrates teen sexuality, instead of saying, look, sexuality is an appetite, and it's a wonderful appetite, but just like any appetite, there has to be some restraint. Okay, just like kids are told, look, you love eating junk food and pizza and French fries and all this stuff. Of course you love it, but here's what happens if you're out of control and you don't restrain yourself. You love going to the beach and being out in the sun, but you know what? You have to understand what the risks are, and they are real risks, and we have these expectations of you that you're going to make healthy choices. Okay, it's in any number of areas, wearing a helmet when you ride your bike. There's just many, many areas in which the approach with young people is a no-nonsense, firm, science-based approach. But in sexuality, that is not the approach. The approach is you are sexual, and that is just fantastic. And only you can decide how you're going to, how and when and with whom you're going to express that sexuality.
Yeah, absolutely.
They're telling parents something different than what they tell kids. That's why I'm always telling parents and educators, that you have to look at what the kids are reading. They're telling you that they're being very careful and they're giving, a safe message, and they're telling kids to, make good choices. But look at what they're showing the kids. They're saying only you can decide. And how are kids supposed to decide? They're supposed to talk with their partner. So two teenagers are supposed to sit down and have a discussion about whether they're ready to have sex. Okay?
Well, we've actually seen a resource here, which is recommended by the Family Planning Association. And this is discussing that teenagers should do sex lists, all the different things that they would like to do, and then discuss with their partner to see which ones it is they agree on, which is, it's just shocking. And your book, You're Teaching My Child What, because I read that on my Kindle, all your resources and any links to any websites, I was able to just click on being on the Kindle. So I seen some of the websites, I screenshotted some of the stuff and shared it. And it's absolutely beyond. And I think that's what we're struggling with, trying to tell people, with people understanding, is no, they're not just being taught, you should be safe while having sex. This is very much a promotion, very much an encouragement. And just to, you were saying this, sexual beings, from cradle to grave. I myself was looking at International Planned Parenthood document the other day, which again is saying that there's 1.7 billion sexual beings, on this planet, young sexual beings. And it's not saying adulthood or childhood, it's referring it all to as personhood, and again about sexual beings. So, what can you tell, where does this come from, that children are sexual beings and they need their sexual rights? Like, why is it we're teaching children this? You know, where does it come from?
Well, that's a great question, and I'll just give you a brief answer. People really should do their own reading and, you know, find out more. But this idea, I'm gonna take it back to Kinsey, Alfred Kinsey, and he, you know, there was a time in the 50s and 60s in which, you know, an ideology became very strong in the US and other Western countries that there's too much repression, that sex education has too many no's, and there need to be more yeses in sex education. And these were people that wanted to, of course, reject any Judeo-Christian values regarding family. So Kinsey in particular did a lot of research on children and even infants under the age of 1, in which he claimed that these children were observed having orgasms. And I would advise that everyone should look into the work that's been done by Judith Reisman, Reisman, because she has devoted her life to exposing Alfred Kinsey's crimes in this area. And she got into this area because her little daughter was sexually abused. And when she spoke to some other people about it, they said to her, well, you know, what do you expect? Children are sexual as well. Children are sexual, so something like, you know, she enjoyed it or what have you. I can't remember the details. And Dr. Reisman was so shocked by that she started to research where these ideas came. And she really has spent decades of her life exposing Kinsey and the entire group of people around him. So today's sex education, relationship and sex education really is an outcome of that movement. Out of Kinsey came the organization, Planned Parenthood, an organization called SICUS, which stands for Sexuality Information and Education Council of the US. And they became really the driving force for sex education in our schools here in the US. And of course, Planned Parenthood is international, Planned Parenthood Federation. And so this is now a worldwide, very powerful movement that seeks to promote sexual freedom among young people and children. And I want to emphasize again that when sexual freedom is the focus, the idea that we are sexual from cradle to grave, and that even children have sexual rights to express their sexuality and act on any sexual urges they may have, that they have that right, and that the adults around them cannot tell them what's good or not for them in this area, that the child gets to decide, the teenager gets to decide. This is at the very essence of this sex education. So when you're telling that to a child, you can't at the same time be claiming that your priority is their health, that your priority is to prevent sexually transmitted infections, pregnancy, HIV. You can't do that because the two don't fit together. If kids are going to have sexual freedom, if kids are going to decide on their own when they're ready for sex, then they're going to suffer the consequences.
Absolutely. And
just take a minute out.
Yeah.
But it's right. So it's not just a case now of children are being told about their sexual freedom. I think it's what people don't understand when we speak about Kinsey and we speak about these crimes against kids. I don't think people understand, because nobody's been in prison for it, because they've been protected for it. It's like people can't get their head around it. So how have we gotten all this way and nobody's ever been held responsible for these crimes against kids? How have we gotten this far? I think that says a lot about us as a society, basically, because I've seen Judith Reisman's work. I have seen the court documents. She's gone into every single Playboy magazine. She's gone into the pictures. She has gone into absolutely everything. And nobody's been held accountable for these crimes against kids. You know, so we are being told this is to safeguard kids. So what, we got to keep abusing them to safeguard them? Where does that fit into it all? Because people are completely blinded by this, Miriam. They think this is to safeguard kids, and you were there confirming this is built from the abuse of kids. So how do we get here?
Well, Kimberly, in terms of why people haven't been held responsible and criminalized, it's actually even worse than that, because they've been honored. You know, there's an institute that's named after Kinsey at Indiana University, and the various people around him who did horrific things to children and were pedophiles, as Kinsey himself was a pedophile, they also have various, awards and fellowships named after them. And this is why I became an activist and wrote my books and continue to speak out, because it's such a travesty. It's such a terrible thing. And yet there's tremendous money and power behind the organizations that support this ideology. Tremendous money and power. I mean, Planned Parenthood makes a lot of money off of kids, and adults getting abortions and suffering from sexually transmitted diseases and so on. A lot of money. And other organizations also. So, there's no justice. I don't know I don't know what else to say about that.
Well, it's funny you should say that, Kim, because I was looking through some of my uni courses that I can do for free, and there was one that said sexuality and parenthood, so I clicked on it, and last night I thought I'd go through it, and the very first opening chapter is telling me about Alfred Kinsey. I was like, oh my gosh, my own university are promoting it. Like, they're just saying about him, writing about, but yeah, he was the very opening paragraph was Kinsey. I couldn't believe it. But
they're not, what they say there is that Kinsey himself was such a depraved individual. And I had misfortune of actually reading his biography, which I don't know if I could suggest it or not, because it's the most depraved thing I think I've ever read. And his life was just a life of depravity, pedophilia. I won't even describe it.
Is it the book somebody took 25 years to write? Is that the one you're talking about?
I could be, because it's 1,000 pages.
Yeah, somebody's just bought that for me now. She's been reading it, and she said it is the detail in it. You know, she feels as if she knows him. Not that that's a good thing, but it is very in depth, and it goes into many aspects of his life.
No, when I read that book, I felt like I wanted to just like clean my brain after reading it. I wanted to like bleach my brain so that I wouldn't know the things that I read there. Now, this is the father of modern sexuality education. And you know, Dr. Grossman certainly brought it out. She's like the person, she's the leader in this field. But in my book, You're Teaching My Child What, I have some material there about him. And it's important that people know that this philosophy that they're absorbing and that their kids are absorbing when they're exposed to RSE is Kinsey's depraved philosophy. But you know, we could spend the whole time talking about Kinsey. Could I just maybe just turn it a bit right now and go into all the things that are not being told to young people?
Absolutely, yes. I was going to just ask, because, you know, you were saying about, you know, the children, and, you know, that you know, this is being very much talked about on the physical health side, the STIs, and very much because a child has now started developing in a certain way, or if a girl has now got a period, therefore that means she's ready to carry a baby and therefore can be sexually active. And you talk a lot about, there's a lot more to the biology and the physical development of these adolescents in terms of being able to be ready for sex, and that there's so much that their hormones, how they've developed, that they're not being told these things. Could you explain some of these things to us?
Well, what I want people to do is, as you listen to this list of things that are omitted from RSE, or comprehensive sexuality education, have in mind that if the goal of these educators was to keep young people healthy and out of the office of doctors and therapists, they would be, they would put all this information front line and center instead of omitting it. Do you follow me? For example, if they really cared about avoiding sexually transmitted infections, there's two areas I want to point out. One is that they give a false sense of security to young people about safe sex, so-called safe sex, and use of condoms. They're misleading young people and their parents to believe that condoms are almost perfect protection against infections and pregnancy, which is very, very far from the truth. The truth is that in terms of pregnancy, when adults, not teenagers, when adults have perfect use of condoms, 100% perfect use, which means every time, correct use every single time, there's a 98% efficacy rate in preventing pregnancy. So 2 out of 100 women, adult women who use condoms perfectly for a year, 2 of them will get pregnant. Now, that's ideal use. No one has ideal use. What we have is typical use. It's called typical use, okay? Now, for typical use of an adult woman, it falls down to 85%. So 15 women out of every 100 that use condoms in a typical way, which means sometimes not, 15 of them will get pregnant every year. Now, teenagers who, that's a whole other story. Teens are impulsive. Teens don't plan ahead. We know this from studies about the teen brain, that their brain is not fully developed, that the part of their brain, the prefrontal cortex, which is right behind the forehead, which is responsible for executive thinking, planning ahead, making good decisions, thinking about the pros and cons and the possible consequences. That part of the brain is not fully developed until a person is in their 20s. And when you're a teenager, it's more the emotional, more primitive part of the brain that takes over during high stimulation, during times of high stimulation. When teens are sexually aroused and they're getting involved in sexual behavior, it's obviously a highly stimulating situation, and the part of their brain, I like to compare it to Star Trek. There's Dr. Spock and Captain Kirk. If you're familiar with those two characters, okay, Captain Kirk is all kind of emotional and reacting based on his gut feelings and emotions. And Dr. Spock is not at all emotional. He's all in his head and his brain, and he's just using his rational thought to react to things. So teenagers are not Dr. Spock. Teenagers are Captain Kirk, which means that, when it comes to planning ahead and bringing a condom, everyone knows that when my kids were teenagers, they couldn't even remember to bring a pencil to school. Okay, we're going to count on teenagers to always have a condom in their pocket, to always, oh wait, I need to check it, make sure that it's still hasn't expired. Oh wait, just a minute, let me make sure that it's good, there aren't any holes that have been put through it. And then there's all the, open it correctly and put it on correctly, and I have to do this, and there's 8 steps or something, or 15 steps that teenagers are supposed to slowly go through each step. Give me a break. So we know already that with adults, there's only an 85%. This is about pregnancy, not STIs. With teenagers, it's going to be way lower than 85%. So parents and teenagers, you think that if you use condoms, you're protected. I would caution you to not have a false sense of security. A lot of you actually will get pregnant, and a lot of you will get sexually transmitted infections. Let me just move on to that. Now, with protection against sexually transmitted infections, the efficacy of condoms depends on which infection you're talking about. And some infections live on skin that's not covered by a condom. Herpes, the human papillomavirus, 2 of the most common sexually transmitted infections that are out there, they live on areas that are not necessarily covered. So that, even with a condom, you can very easily get those infections. Those infections can be devastating. They can be very painful. I suggest that parents sit down with their kids and go online and go to websites that are created to support those people who have either herpes or HPV, and just go on there. There's tens of thousands of people on these sites, and just read a few posts of how devastating it is to wake up one morning and have your private area break out in warts and painful blisters. This is not good. This is not what you want in your life. So, I mean, you want to call it safe sex, or safer. At one point some years ago, they changed the term from safe sex to safer sex to kind of acknowledge it's not that safe. Maybe it's a little bit safer, but it's really not. And also kids need to know that, it's difficult. It's difficult to all these things, eating properly and exercising and all the things that we tell kids to do. It's hard. And restraining yourself in terms of sex is also hard. But you know what? Compare it to like smoking cigarettes oh my gosh, cigarettes. Look, I'm not for smoking cigarettes. But from one cigarette, you're not going to change. Your whole life is not going to be altered. Whereas you could have sex one time and get pregnant. You could have sex one time and get HIV. That's your whole life, guys. This is going to change your whole life. Herpes.
I was going to say,
change your whole life. Sorry?
No, so I was just going to ask a lead on from that, where like those health effects, and we know as a teenager, managing relationships as a teenager, or as as soon as you hit the double digits, whether that's friendships or crushes, it's it can be a difficult time to manage. And girls in particular are a lot more emotional. They're a lot more emotive when it comes to relationships, especially if it is a crush. I had the severest crush when I was younger. I thought, I was in love.
We all did.
Yeah. And this is it. When we have crushes, and now there's this expectancy of having sex now is actually okay. In fact, we're teaching them consent. We're teaching the boys how to get the consent, and we're teaching the girls how to consent to their requests. And the emotional side.
Yeah, the side. Right. So that's okay. So first, what I wanted to deal with what kids are not being told and what they're being misled to believe. Number one is safe or safer sex and the efficacy of condoms. Okay. We can go next to the emotional side, and then after that, I want to talk about how girls are more vulnerable than boys to sexually transmitted infections.
If you'd like to carry on with that, as you're already talking about that, that's absolutely fine, Miriam. Me butting in and getting excited, I was.
Okay, I'll go to that. So what girls are not told, and of course, if the priority of these educators was to keep girls healthy and happy and out of the office of doctors and therapists, they would say, you know what, girls, you're actually more vulnerable because of your biology. You're more vulnerable than the guy that you're with to getting a sexually transmitted infection, and a serious sexually transmitted infection. And that is because the entrance to the cervix, which is called, the entrance to the uterus, which is called the cervix, is still maturing in a teenage girl. And because it's still maturing, the surface of the cervix is thinner and less protected than it's going to be as the girl gets older and becomes an adult. So it is easier for chlamydia, herpes, the human papillomavirus to infect that area. And nothing is going to cause that area to mature faster except time. And everyone wants to know, when is my cervix going to be completely mature? And the answer is, I don't know. When you go in for your, if you go in for an exam and the doctor inserts a speculum, the doctor should be able to actually see how big that area is, called the transformation zone, and tell you, but in a way, that also is not so useful. So bottom line, this message is not provided by RSE or comprehensive sexuality information, because it would highlight the differences between male and female, which of course is something that they never ever want to do. They never want to do that. So girls don't get this information, and they are unable to make fully informed decisions about the risks that they're taking. Now, I'm going to add on something to that, which is that regarding anal intercourse. And that is that anal intercourse is a very high risk behavior for the individual that's being penetrated, whether it's a male or female, because the lining of that area of the body is also very thin and easily torn and easily infected. So this message would also go for boys that are experimenting with sex with other boys, and also for girls that are having anal intercourse, which is something that is presented to kids and to adults as all being the same. They're told there's 3 kinds of intercourse: oral, vaginal, and anal, and they're all kind of presented in the same way when they actually have vastly different risks. So I'm going to move on to the subject of the emotional risks that people are not told about, their own, physiology, the way that we're made. We are made, both male and female, to emotionally attach to the person that we are intimate with, because through intimacy and also through kissing and gazing, like positive, the look of love between 2 people, and touching, stroking, intercourse, orgasm, these activities cause the release of a hormone called oxytocin. A hormone is a chemical that travels from one organ to another organ with a message. So oxytocin travels to the brain, and it gives the brain a message that this is somebody that you can attach to. This is somebody you can relax, and you can trust this person. You can trust this person. Now that's really, really big when you think about people having casual intercourse with strangers, and then developing feelings of attachment and trust. Now, I will say that oxytocin and also other hormones that play a part in this, oxytocin exists in both men and women, but it is primarily a female hormone. And there's very fascinating things about the hormones that we have. I'll tell you one fascinating thing, and that is that around the time of ovulation, when a girl or a woman can get pregnant, that's when her estrogen is highest. And estrogen gives a boost to oxytocin. So when a woman has intercourse around the time that she's going to be ovulating, unless she's on the pill, her estrogen is going to be very high. And so her oxytocin is going to also be powerful at that time. And you can imagine why, if you believe in evolution, or you believe in God or nature, however you want to put it, that at the time of ovulation, when intercourse could result in pregnancy and a new human life, that women are made in such a way to attach to the man that they're with and to trust that man, because you're going to need that man if you're pregnant and then you're going to be raising a child. So it makes a lot of sense biologically, but this sort of information is omitted from the sex education that our kids get. The mainstream sex education, relationship sexuality education that comes from these large organizations, and that you in Wales are trying to fight right now. So so I talked about the false sense of security from condoms. I talked about the vulnerability of young women. I talked about oxytocin and how we biologically, even if we don't want to get attached to people that we're intimate with, it does happen. And when I explained this to some of the girls that would come in my office, they were just, it all made sense, but they were so shocked, because these were young women who, had, I don't know if this term is even used anymore, but friends with benefits, where you establish a kind of sexual relationship with a guy, or a girl, I should say, as well. And you hook up, a few times, and then the other person is no longer interested, or, only interested in sex and doesn't want to get to know you as a person. And, this can be painful and disappointing to people. And they would come in and you say, I'm thinking about this guy all day, and I don't even know if he knows my name. Why, what's wrong with me, Dr. Grossman? What's wrong with me? And I'd explain that nothing's wrong with you. You just haven't been educated about your biology.
Absolutely. Only a few years ago did I actually really start reading about, I think we're all very aware of those few days before we get a period that we're moody, but we don't consider actually how our hormones are being affected during other times of our cycle, especially during that ovulation time.
Oh yeah, and ovulation, I'm telling you, the research there is just amazing about how women, just under the surface, we don't realize it, but in the childbearing years, we cycle in so many ways. Our appearance, it's like under the surface kind of ways, the way that we talk, the way that we walk, our interests. We're more interested in like shopping for clothes and makeup and jewelry during that time, and sort of adorning, more into our appearance, whereas closer to the period time is they've shown, and one study showed that young women actually shop more for food at that time than for clothes and jewelry and makeup. So yeah, there's a lot going on.
Oh, before I ask you about another area of the sex education, can I just I never introduced Beth at the start, and there has been a few people in the chat asking who Beth is up in the corner, and obviously Beth is your wonderful assistant. So apologies for not introducing you at the beginning,
That's
Beth.
Okay.
And
Dad, you didn't do an introduction at all. You didn't even say good evening to everyone. You just flew straight into it.
Well, I'm going to say thank you for doing that. I'm just going to say Beth does not like being talked about, but I am going to say one thing, and that is that Beth contacted me many, many years ago at the beginning, like more than 10, 12 years ago when all this started happening. And I started writing and speaking, and she just said, let me help you, let me help you, let me help you. And finally, we met and we talked, and I decided, yeah, I mean, I certainly need help. Believe me, I didn't have anyone, like a whole team around me helping with different things. So I gave her a few little jobs to do, and then I wanted to pay her, and she wouldn't let me pay her. And she said, you know what? Pay me in books. Send me your book, Unprotected. Like, send me a carton of your book, Unprotected, or your book, You're Teaching Your Child What. And she would go out and give them to everyone she knows. She'd go to doctors' offices and, her friends and relatives and people that she knew in the health field and in the legal field. And since then, we've become very good friends, and I couldn't do any of this without that.
Oh, that's
Thank you.
Brilliant.
Yeah.
Oh, well, it's lovely to have you here as well, Beth. Miriam,
thank
something
you.
else I want to ask you, which in the sex education, what I would see is kind of very desensitizing information. So, for example, one of the earliest stuff we have is this, that children need to know the correct terminology for their body parts. And whilst doing this, being exposed to adult genitalia, and like we're trying to, a lot of people don't see, what the problem is this, and we're trying to say how, this is desensitizing them in terms to explicit words already for when they get into kind of that secondary education, when the sex education gets more explicit. Do you think that's an element?
Okay, I think this is a very important element. I'm a child and adolescent psychiatrist. I don't see the need for little children to have the anatomically correct terms for their private parts. I think that it is sufficient to tell children that the areas that are covered by a bathing suit are private, and that no one should be touching them there or asking to see them, to see those parts of their body, and no one should be asking them or having them see those parts of their body. I think that is sufficient. My concern with introducing these terms in school or in preschool is that there's a few things. One is that it gives the child the message that school is the place for these things, where I learn about these things, about these issues, about my private parts. It desensitizes them, and that's a really important word and concept. Because kids have a sense of innocence, and kids have a sense of embarrassment, which is healthy. And we shouldn't be dishonoring them. However, the philosophy and the worldview of this sex education industry, and it is an industry, is that childhood innocence has no value, and that it's repressive and harmful. So
that social childhood innocence as such is a social construct, and not necessarily true. That was just in my own psychology books, which, like you said, is what they're saying. They're not all innocent. There's more to it than that.
Well, there's no value to innocence in their minds. But let me just return to the concept of, if you have a 5-year-old and they're learning in school about, about a penis and testicles and vagina and vulva, then the following year, when the teacher brings in other material that's in this area of sexuality, sexual behavior, or what have you, then that child is already used to discussing these things in school. Like this is normal. This is where I'm going to be learning about these subjects. And the teacher is the person that I can trust to introduce me to these subjects. And I object to that because I think that certainly young children should be exposed to these things at home in a way that the parents are comfortable with. And if the parents are only comfortable with saying what I just said a moment ago, that the parts that are covered by your bathing suit are private, that's fine. A girl does not know. I didn't know what a vulva was until I went to medical school.
Yeah.
5-year-olds need to know about a vulva and a clitoris. This is desensitization. This is introducing kids to an area of life that they are not ready for.
Yeah.
And which opens up, this is a whole other area that I want to just comment on, which is that kids are not miniature adults.
I totally agree.
Kids are not miniature adults. They are not equipped cognitively to absorb the information that an older child, a teenager, and an adult is able to absorb. And we are bombarding small children with information that they're not ready to absorb, such as about intercourse, about gender, and girls who may be boys and boys who may be girls, being born in the wrong body, having a boy's brain and a girl's body. This is material that children cannot absorb.
And that was something I was going to speak to you shortly about, is the gender, which is hugely being pushed in schools. A lot of debates going on each side. The big push is for an affirmation type education. But just before we did quickly discuss the gender, I just wanted to quickly cover contraception with you, if that was okay, and the promotion of abortion in the sex education, and again the kind of health implications of that before we went on to the gender side of it. Is that okay?
Of course. And again, there's so much that could be said. I wrote a very important chapter about this in Unprotected, because so many of the young people that came to me in my office at UCLA had abortions, one or multiple abortions, and had been led to believe that for most people, for the vast majority of people, an abortion is a minor event that is followed by relief. And what I was seeing in my office and what I was reading showed that's just not always true, and that there are large numbers of women and men who, for many, many years, for decades after an abortion, are still thinking about it occasionally, and maybe not so occasionally. In other words, maybe often, who have regrets, who wonder what would have been if they had decided differently. And those people, their voices have been silenced, especially the men's voices have been silenced. In my research, I read about men in their 50s talking about the trauma of an abortion that their girlfriend had in college, and still wondering what would have happened in my life if we had chosen differently. Again, I suggest that people go online, and there are support groups for women, and I don't know if there's men on there there's probably men on there as well. There's one called afterabortion.com, and there's thousands and thousands of people. This does not mean that these people don't think abortion should be legal. This does not mean that anyone is commenting about the legal issues. We're talking about the emotional issues that are being covered up and whitewashed in young people's education.
Yeah. And not just that, the health risks that could be involved. And of course, importantly as well, that this is all being done with these children are being told you don't have to tell your parents about this. And as a parent, you could have a teenage girl who's changed, whether it's through her behavior has changed, becoming withdrawn, becoming more emotional, or perhaps even becomes ill. And like you said, that child's now kind of been programmed that the school is the one who is to help them on this.
Yes, but you know what? You see, what happens is that because young people have been convinced over and over and over again, they've heard over and over and over again that an abortion is not a big deal emotionally and people just do fine afterwards, that then if you happen to be one of those people that doesn't do fine, then you start to think, oh my gosh, what's wrong with me? There's something wrong with me. And in fact, I was an expert witness at there was a trial of a psychiatrist who had a patient, a young woman who had had an abortion and became extremely depressed and ended up committing suicide. And the family sued the psychiatrist for never even having asked this girl if she had had an abortion. And this is one of the big points that I'm making, is that therapists, as part of their regular evaluation of any teenager or adult, male or female, has to ask the question, just like we ask, how much caffeine do you drink? And have you ever been molested? And all these sorts of questions. We have to also ask, have you ever had an abortion? And explore that a little bit, because when we don't ask that, and I myself didn't used to ask it, when we don't ask it, it's a message to our patient that it's not important. That the amount of coffee I drink is important. The number of hours I sleep at night is important. But whether I had an abortion, that's not important to my mental health.
Yeah, there's just huge gaps of really important, valuable information missing from this education. And as you started to say earlier, there's other parts of this education which are just, it's going to change this generation of children from here forward with this, you know, especially this, the affirming gender ideology, which is in this education of, I don't know, it seems to be teaching the children about the social construct of gender roles and gender identity, and then telling them that they could be born in the wrong body to fit in with the social role that they're saying is being created. And it's you know, it's very, very confusing. Our consultation for the RSE came out 2 days ago, and one of the areas in it is defining, is a glossary defining a few words. Gender is in it, and it talks about identities and stuff, and then it gets to sex and it says male, female, non-binary, and that's, you know, that's on the government document. So, you know, what is this about? So, you know, what is the dangers here? What is going on this side, Miriam? Explain this to us.
Well, first, let me explain that definition of sex is incorrect. Sex is based on what sort of gamete. A gamete is either a sperm or an egg. So a person is identified as sex, or a person is identified as male or female based on what type of gamete their body produces. And there's only two different kinds, a sperm and an egg. Females make eggs and males make sperm. In general, 99.98% of people who make sperm have XY chromosomes and male genitalia, and 99.98 or more percent of people who produce eggs have 2X chromosomes and female genitalia. What this is about is, and it's important to see the big picture here, okay? I mean, there's so many little details. For example, the language that's now being foisted on us, of course. But if you want to see it, you know, a bird's eye view, really, it's about a vision for society in which the distinctions of male and female are just erased. I believe that that's what the goal is. So when you teach people that you could be born in the wrong body, and you know that a boy could be born in a girl's body and just needs to take some pills or some, you know, has to take estrogen and have some surgery, then what does a boy and a girl really mean if one can become the other? Okay, if an apple can become a banana quite easily, what does that really mean, an apple and a banana, if one can turn into the other? So I believe that is the goal here. And there's been a lot of success toward this goal. Of blurring, first it was just blurring the distinctions, but now it's really eliminating the distinctions. And I hear about many people, I have a private practice in which I have gender questioning young people in the families, and I hear about and I meet people who they no longer want to be the other sex. They want to just be a little bit more masculine or a little bit more feminine, since they've been told that male and female is on a spectrum and that there's many points on that spectrum. And so they might be deciding at the age of 16 that they want to move a little bit more toward that female side. And so I'll take a little bit of estrogen, but I don't want to be a full-blown female. So that's the purpose of this.
Sorry, Miriam, there, I was just grabbing the charge. And
can I just say something? So I know there's probably going to be some parents watching this that's actually going through this with their teenagers, and their fear is losing their child by not supporting it, but then supporting it and potentially losing their child further down the line anyway. What advice would you give to those people, Miriam, that feel that they're stuck between a rock and a hard place?
Well, I'm not sure what your laws are over there. We have some states where legislation has been passed regarding what therapists are able, what kind of help therapists can provide. You have actually a wonderful, wonderful therapist by the name of Stella O'Malley. When I say you, I'm sorry, she's in Ireland.
I can still write it down. That's interesting. Take down. Stella, what did you say?
O'Malley, Stella O'Malley. She's a wonderful psychologist who I would put it this way, she looks at the whole picture of the child and not just that part of the child that has to do with their gender. She believes in exploring the totality of the child, everything in their life, who they are, their family, their personality, any other conditions that they may have, because a lot of young people who question their gender have comorbid conditions of anxiety or depression, or they are on the autistic spectrum. And so it's important to explore that. And there are many websites and parent support groups that parents can turn to for an alternative to the automatic knee-jerk affirmation approach. I believe that the automatic affirmation is really doing a disservice to the child and their family, because gender is very, very complicated. People are complicated. We're not like Legos. Oh, I'll take this part off and I'll put this part on. We're not like Legos. We are very complicated beings, much more, if I had to compare it to anything, like a computer with a very complex system, with one part of the system that affects other parts of the system. And these children are really suffering, and their families are really suffering, and they deserve to be looked at with compassion and with understanding and with the knowledge that a well-trained therapist has about child development and about comorbidities and about families and about abuse and trauma. There's often trauma that is underlying the gender confusion. Anyway, so there are many parent support groups. There's a site called Parents of ROGD Kids. ROGD stands for Rapid Onset Gender Dysphoria. Parents of ROGD Kids. That's one site. There's a fantastic site called Partners for Ethical Care.com. There's a new book that came out called Desist, Detox, and Detrans, I think it's called, by Maria Keffler. Fantastic book for parents with excellent advice and insight. Maria Keffler, compares the transgender industry to a cult. And it does indeed have many features that are cultish. So I suggest that book as well. There's an excellent book by, well, I mean, I can suggest my own book, but of course, but there's a recent book specifically about girls, because recently it's been much more the girls that have been presenting at gender clinics, and it's called Permanent Damage.
Irreversible.
Oh, sorry. Thank you, Beth. Irreversible Damage by Abigail Schreier. That's a good book.
But you know, as I was listening to you, it's a female, it's a young female, and for me, I've always been concerned of the high percentage of children with autism that's transitioning, and what you find is girls get diagnosed a lot later than boys as well, you know. So for me, that's a real concern.
Yes, girls get diagnosed later than boys because they tend to have symptoms that are not as easily picked up, and they turn to the gender issue. The girls do, because a lot of them identify more with boys because they have their brains, since they're on the spectrum, their thinking is more linear and concrete and often very rigid. And so they're more comfortable studying, let's say, you know, the sciences, math. They don't fit in with the girls who are, you know, so very verbal and very, I mean, I'm using stereotypes, but actually the stereotypes are, in many cases, are valid. They're, you know, these girls are not going to be the ones that are rushing into the girls' bathroom to, you know, talk, giggle, and chat about boys and fix their hair and all that stuff. And so they feel that they don't fit in with the girls, that they don't belong. They might have, their best friends might be boys. They might not feel comfortable with their bodies. And so when puberty comes along, They have increased anxiety about their bodies, and kids on the spectrum have a lot of anxiety anyway. And then when they're exposed to these ideas about gender, it's very easy for them to slip into that and say, that's what it is. That's why I feel more comfortable with the boys. That's why I think more like a boy does, and I'm more interested in the math and in the I'm just blocking. I'm getting tired. The anime, the Japanese anime cartoons. A lot of the kids on the spectrum are into that. We didn't really have a chance to talk about that, but gaming, the technology. A lot of the kids on the spectrum are into the technology, and they're not so comfortable necessarily with other people, so they're very comfortable online, and they make a lot of friends online. They're on YouTube, they're on all the social media, and they make friends there, and they just slip into the whole they go down the rabbit hole.
I think that's a very important thing to stay there when you're saying about this online. Children, we know through psychology anyway, are generally questioning their right, figuring out who they are, throughout, but also that kids want to be part of a gang. They like to be accepted, and that community, you are welcomed into it straight away. You're showered with with love and all this positive, very much makes that child then feel like, oh my God, this is what I've wanted. I finally belong somewhere.
Yes, I found my people. And you're right about the 24/7 love bombs. Like, you're amazing, you're fantastic, you're so brave. And it's really, really good for anyone. Who doesn't want that? Everyone wants that.
Yeah.
But again, I would just throw in this question. If the trans community online, if their priority really is the health and well-being of these young people, and when one of these kids decides that, you know what, I think I'm this isn't the path for me. I'm go off hormones. I'm not going to get surgery. I'm actually okay with being a girl or being a boy. Isn't that's good? I mean, the child has avoided dangerous medication. The child has avoided life-altering surgery that can result in a lot of difficult consequences and side effects, among which are loss of sexual function. That's a cause to celebrate, to say, oh, okay, good for you. You really did discover who you are. But instead, these people are demonized.
Well, in fact, they're trying to stop any help. And I think it's like the therapy that you were talking about earlier. Was it Sally? Was that her name? Would that now be what would be classed as conversion therapy, to be having these children explore other areas? Because there's a lot of that in the media at the moment, which is that, it has to be affirmation therapy only. I know there's been a group of doctors built in here to say that, absolutely no, that any therapy which doesn't affirm will fall under conversion therapy, and they want it banned.
Okay, so, but you have in the UK, the Kira Bell case in December came down, and the High Court of the UK put it beautifully. They just put it beautifully.
Yeah.
And they said, this is an experiment. Essentially, that's what they said. This is an experiment. We don't know what's going to come of these young people being given hormones, blockers and cross-sex hormones so early in life. We don't know if they have the capacity to give consent to be essentially sterilized, and therefore the court in the UK said that kids can only be given these medications if they are with court approval. I think that was the final. I think you have to be over 16 and you have to have court approval. I get confused because there's also Sweden and Finland also came out with similar announcements. They studied the data and they looked very closely at all the numbers, and they came to the conclusion, all three countries, that this is an experiment, a dangerous experiment on young people.
Oh, less than 2 months later, they kind of backtracked, Miriam. They've now said that if a child cannot consent, the parent can consent on their behalf. So in less than 2 months, they kind of backtracked on that, which for me, that's a serious concern, because I personally believe that the parents should have a psychiatric assessment as well, you know? Because if this was 30 years ago, my mother would have got joy out of being welcomed by that community, you know? She would have thrived off something like that. But they've gone back on it less than 2 months later. They've gone back and they've said, actually, a parent can consent on the child's behalf.
So this is the High Court that went back. I didn't know this. They went back and published a new opinion?
There was a new ruling after that. There was a new ruling just after that.
Well, you know, we don't have time really, but the thing is that parents are going to give their consent because they're terrified of the child hurting themselves.
Yeah.
You know, that's another discussion.
Yeah. Oh, there's absolutely so much more that we could discuss. I could talk to you for hours. Because I did want to point out to people that like all your work that you've done into this, and you mentioned it briefly earlier, is that it has brought you to courts and you've testified. And I just wanted to ask before we did leave to say, because you came to the UK and you've spoke at the House of Lords, and I was just wondering if you could just tell us a little about that, and just you know how deeply you've actually got in. I want people to understand how deeply you've got involved in fighting, you know, this comprehensive sexuality education.
I have really traveled. I've traveled a lot. And one of the places I was able to go to was the House of Lords 10 years ago. I was invited by an organization called Anglican Mainstream, and that's Dr. Lisa Nolan, and she's still fighting. I spoke at the House of Lords about many of the things that we discussed today and more. And before doing that, I studied the relationship and sexuality education program, that the curriculum that Dr. Nolan and her organization were trying to prevent from being voted in. And I found that there was, to my shock, it was even worse than what I had found here in the United States. In other words, I found websites that were being recommended to young people that had links on where to, like what bars in London to go to for, you know, for a hookup, for gay hookups. So yeah, I've been doing it a long time, and I hope to be doing it for a long time.
And I know a lot of people, I could see on the chat, a lot of people have, you know, I think the gender side of this as well, I think is getting a lot more publicity than the other safeguarding aspects of the sex education, which I think it's so important why our organization is raising this side, because a lot of organizations are raising awareness on the gender, but a lot of people have asked us about the gender. We haven't covered very much of it, and so I just again want to let people know that you have kindly said you will do a webinar for us on the gender topic. We haven't set a date yet. Things have got very busy here with our elections, and I know you've been very busy also, so hopefully we can get a date penciled in for that also. But so yeah, I just want to let people know that that's coming up, and I'm sure lots more. We're certainly looking forward to it. Just before we go, if there's anything you would like to say yourself, Miriam, or if Kim, is there anything else you add? From what I can see in terms of questions, some of the questions that were asked, which you then answered as you was talking anyway. But yeah, I'm just incredibly grateful. Very nervous I am still. I've never interviewed somebody before, so I'm a little bit nervous. So sorry for any stuttering or...
You did great.
Thank you, Miriam. Thank you.
I'll say one last thing, and I want to just say to the parents, you know your child best. You know your child. If something goes against your gut, follow your gut, because there's a lot of experts there that want you to believe that they know better than you. And I really think in the vast majority, I've met a lot of families and parents in my career. And aside from, you know, a few outliers, the vast majority of parents love their children and want the best for them and know them and know what's good for the child. So don't let yourself agree to something that in your gut you don't agree to.
Absolutely. I think that is so important. If you don't feel like your child should be learning stuff, but you're afraid to not agree because you'll be seen as maybe you're not progressive or not with the times, or, you know, this is individuality. We know our children best. We know the morals and the values and you know, the course that we hope our children would take. And I think no parent should feel shamed or wronged or too shy, embarrassed to stand up and say, actually, no, I'm not comfortable with that. It doesn't, you know, even if it makes sense to all of you, it's not making sense for me. And, you know, and question that gut feeling.
Sometimes it's about buying time, isn't it? You know, you just got to buy some time in a lot of the case, because as we know, a lot of them change their mind by adulthood, you know. So I think it's just a case of buying a bit of time and giving them the correct information. You've got to give them the correct information out there, and you've got to show them the wider picture when they've just been given this one alternative, and that alternative celebrates them, you know.
And also to remember that kids really do care what their parents think.
Yeah.
Even though it may not seem like it, they really do want your approval, even when they're old enough.
Yeah.
Really do want your approval. Again, even though it may seem the opposite. And so when you tell them that you have these certain expectations of them, because you know this is you know that they can do it, and it may be hard, but you have faith in them, and not necessarily about being sexually active, about all kinds of things. That's good parenting.
Yeah. Yeah.
Okay.
Oh, thank you so much, Miriam, and we will speak soon. And
Adele,
yeah.
I think
Adele?
Beth just had
Yeah.
your finger up.
If,
Sorry, Beth.
if there's time, I was going to ask Miriam to take just a couple minutes to explain her book, The Black and White Puppy, and why you wrote it. Because
Yes,
it does tie in.
it is a
I've
beautiful.
I've got to hear
book.
actually.
Oh, there it is. Okay, thank you, Beth. I'm not a good promoter of my own work. I wrote the book, Black and White Puppy. It's for kids, I would say, I don't know, 2 to 6 or something. And it has beautiful, beautiful illustrations. And it's a story about the biology of love. I wrote it so that parents can reach their children first before the radical ideologies that are out there reach the child. In other words, I want children to know, number one, that everyone needs a mother and father. And that even though there are many instances because of loss or tragedy or divorce or what have you, that people do not have both their mothers and fathers, that need still exists, and that when a child doesn't have their biological mother and father, there will be some sense of loss at some point in their life. I explained there that there's a biological bond between mothers and their children that begins before birth, because there are certain things that are happening while the fetus is developing, while the child is developing. There's things that are happening within the mother, in her brain, hormonally, and different things that actually create a bond between the mother and child. It doesn't just start to happen after birth. And I brought that in. One reason I brought it in is because kids are being led to believe that you can create a family in many different ways. And that is true. You can create a family in many different ways with the assisted reproductive techniques we have. But the ideal family, and not everyone is going to have an ideal family, but there is such a thing as an ideal for the child. And that is to grow up with their biological parents. I'm not talking about if one of those parents is abusive or all those, horrible things that do happen. I'm saying, given that everything is healthy, the ideal is to grow up with your the mother whose egg and the father whose sperm united to form you, so that your genetics are clear, you know where you came from. People have an inborn yearning to know where they came from. That's why we have all these TV shows now, you probably have them also, in which people are looking for their adoptive parents or their, brother or sister who, you suddenly discover that, your father had an affair and you have a half sister living on the other side of the country. And, we have all these shows right now that are very emotionally packed shows that demonstrate that biology matters. Biology matters. And this is not the message that our kids are getting.
I think that's incredibly important. So I think it's a great book, and also your other books, Unprotected and You're Teaching My Child What, are all on Amazon. And I think even though You're Teaching My Child What is from what you have discovered in America, it's still so relevant, and I think every parent should read that book.
Oh yeah, it's not limited. Also, there is a little pamphlet that people can download for free from my website. My website is miriamgrossmanmd.com, and there's a pamphlet that's called Sense and Sexuality. You can read it in 5 minutes, and it has like boom, 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 some of the points that I brought up today. You can download it, you can print it, and so that's also good.
I was just going to ask about your website. A few people in the comments were asking how they can follow you. I know you have a Twitter. I'm not sure if you're active on Twitter. I know you've been incredibly busy, so
I opened up a Telegram account.
Yes.
But I haven't started telegramming. What do they call it? I haven't started posting things there, but I would love for people to follow me on Telegram. I guess
I will share links for your Telegram. You can share it in the chat and share it in the group, and and we'll keep people posted on when it is that you get telegramming.
Also, there's a link to Miriam's website on our website. It's on the resource pages. If you scroll down, Miriam's there, and also Judith, there's a link directly to their websites on there as well.
Fantastic.
I set up my Telegram with one of you guys, right?
You set it up with me, Miriam, yes.
So Adele, I'm so sorry. Is it currently set up so that people can follow me?
No, you haven't. You hadn't activated it. You set it up. You wanted to do a few bits because you had a bit of a bio you could have added, and
okay, we'll talk separately,
okay. Okay, well, thank you. We've gone over a bit, so thank you, Jason, for letting us go over. Thank you all so much for watching.
Been fantastic.
Miriam, thank you again so much. We're just ever so grateful, and I will be in touch with you shortly.
Yes,
Thank you, Beth, as well. Thanks, Beth.
Thank you,
always,
Thank you.
You always join us. Thank you.
Thank
Brilliant.
you.
Good night, all.
Good night.
Bye. Bye-bye.
Good night, everyone.